Okay. All right, good evening. My name is Obed Figueroa, and I'm from the National Medical Fellowships, NMF. I'm the program manager, and we are pleased to present to you the first Scholar Spotlight session. Our first presenter, will be Oz Hasbun. He is a third-year United Health Scholar, and he is also a third year at Columbia University Medical University, excuse me. And, we're excited to have him, and I'll continue reading his bio. For the last 2 years, he has worked on the design and implementation of an interpreter training program for hospitals. The program has been established at Columbia University Medical Center and trains undergraduate and graduate students as volunteer interpreters at the Columbia student-run free clinics in Washington Heights, Harlem, Midtown, as well as New York State Psychiatric Institute, Washington Heights Community Service. So we are very pleased to present Oz, and, take it over, Oz. He has the presentation. The PowerPoint is available.
Hi guys, my name is Oz. I'll be talking to you guys today about program design and volunteer recruitment, since that's kind of what my project has really encompassed for the first 2 years. So as a quick overview first, before I get started, I'll give you guys some background of what I've been doing. So briefly, an interpreter is someone who's bilingual and multilingual, and they're trained in techniques and practices that actually facilitate communication when two individuals don't speak the same language. So there's more to an interpreter than just knowing two languages, which is what a lot of people think of as an interpreter. That's kind of just a prerequisite to be an interpreter. So my work is really focused on making it so that bilingual individuals who want to volunteer at clinics and community health centers across the country are able to do so properly. Training is required because there's a lot of literature actually now that shows people who are not trained in interpretation, who are just bilingual speakers, actually make a lot more errors of interpretation than someone who's trained, and these errors can have potential clinical consequences that are pretty devastating in some cases. So it's kind of an unsafe practice that I'm sure a lot of us have actually done many times, to interpret for someone who speaks a different language, from a family member or friend, without training. And most of the time it's okay, but there's some times where you make a mistake and you don't know, and it can really hurt a patient. So that's what I've been working on. I've been kind of working on addressing this issue. There's a lot of people in community health centers who want to volunteer their time and their abilities to help others who don't speak the same language, English. So how do we make it so that these people who are volunteering at these sites, where a lot of low English proficiency people seek their care, how do we make it so that these individuals are actually qualified to do that and don't actually inadvertently damage the care for limited English-speaking patients? So my approach to that was kind of a two-pronged approach. The first year I kind of designed the intervention. The intervention was basically recruiting people who already want to volunteer at clinics as interpreters. So basically, I focus my efforts on pre-medical undergrads, and then I developed a training for these volunteers based on recently published new training guidelines for volunteer interpreters, and using basically the broadest kind of categories and literature on interpreter trainings out there, and adapting it to fit the New York City healthcare system. That was the first year. The second year, I decided it was set up and it was ready to go. So I implemented the training, and I wanted to ensure that it was sustainable after I finished my role in it, in setting it up and developing it. And I also wanted to establish a structure that was able to expand to other clinics in New York City besides the one I implemented the program at. So lessons that I learned from doing this. The first things about program design, which I focus on the first year, was clarifying the program goals is really important. You have to really set a realistic expectation of what you're going to do and what exactly that means, and also establish a fundamental mission for you, because sometimes you won't reach every single thing you set out yourself to do, but if you can still achieve the mission of your intervention, I think that's the best thing. You also need to identify specific steps to achieve this. If you don't set out specific steps, you're going to be pretty loose at what you're accomplishing, and you maybe won't get as far as you thought you would. The other key thing is identifying community partners that align with your mission. So like that fundamental mission of what you're trying to do, that really is key to recruiting people who can help you achieve that. If they align with your mission, they are more prone to actually help you achieve what you're trying to do. You can also identify possible barriers before you start, so you can work on them ahead of time. A lot of times when you start doing something, you'll come across barriers that you didn't expect, and that's fine. But if you can anticipate some of those earlier, you can actually move forward a lot faster, more efficiently. The other thing would be finding possible solutions for them ahead of time and partners that can help you overcome these barriers. And the last thing would be identifying obstacles to ensure sustainability afterwards, and solutions that you can have for these possible sustainability issues. So my project, as I said, was kind of establishing this like volunteer interpreter training program for people who want to volunteer as medical interpreters. So I wanted to have a partner who could kind of sponsor these students. So after they're done with their training, they can actually go and use this training somewhere. So I found a clinic that aligns with my mission. My mission was to provide better care for immigrants who don't speak English. So that's really any clinic who cares for immigrants or a large population of immigrants will have a need for interpreters, and they'll probably align with my mission. So I found a clinic, Columbia, who was an accessible partner. It was called the Columbia Harlem Homeless Medical Partnership, or CHAMP. So this is a site of intervention, and it's basically a clinic in Harlem, West Harlem, that serves a pretty large population of non-English speakers. So this clinic didn't have any trained interpreters beforehand, so I approached the clinic, let them know this is the project I'm working on, and I want to provide basically just trained interpreters for you guys, which obviously they were not opposed to. And they wanted to jump on this project with me. So they became my first partner. They became the people that were going to have the students come, after their training, come interpret at the clinic. The timeline I set up was basically the first half of the intervention was going to go for about 2 to 4 months, depending on when I rolled it out. 3 to 4 months. And I was going to basically do all the classroom instruction for that part. I was going to do all the teaching how to be an interpreter. I guess for background, I should say I'm a trained interpreter, and I was trained, I guess now 4 or 5 years ago. So I'm able to do this, but I also enlisted the help of other interpreters who are trained and also trained to train interpreters. And that was the person who actually led all the classroom instruction. And again, it was just about finding partners who align with my mission. It was an interpreter who was willing to do this work for very little compensation. And that person led the theory-driven instruction for the course, which basically was the first half of the intervention. The second half of the intervention was less classroom-based. It was more like hands-on instruction. So that was kind of like, these interpreters were now, did the completed minimum requirements to be an interpreter in a healthcare setting as laid out by all the literature. And now we're just like getting better at it. And they were doing this at one of my partner sites, which was CHAMP, as I just mentioned. So those are 2 parts. And I designed my program to kind of basically when you're thinking about program design, you have to really think about how you're going to accomplish your second goal. My goal was to have these volunteer interpreters be really good and have them know everything they need to know to be a good interpreter. So my intervention design was kind of revolving around that. The first half was all about learning the theory of interpretation, the roles of the interpreter, the modes of interpretation, the code of ethics, note-taking, managing encounters, cultural brokering, medical terminology. So that was all basically like getting towards the goal of having them be competent in interpretation. And that's what I pulled from the literature, I pulled from national guidelines, I pulled from a bunch of places to develop this model. And that was like one of the biggest goals of the intervention that first year that I was kind of sticking really closely to. The second half of the intervention, basically the second year I was in the fellowship, the second part of the first year of the fellowship was kind of making them even better. So that, again, going back to my goals, was I wanted to get them really good. A lot of that is getting practice and not just doing theory. So what that meant was really having them do interpreting shifts, having them do shadowing shifts as professional interpreters, getting some individualized coaching, assessments, and reflections on language labs. So all going back to the initial goal, like I wanted them to be very good. So that was why I designed my program the way I did. Another thing to note is, of course, I was taking into account the schedules and things like that that would prevent people from participating in my program. So these are undergraduate students. So I wanted to make sure that I was catering to an undergraduate student schedule. So I was basically very much cognizant of things that could prevent people from participating in my program and making sure I addressed this ahead of time. The classes took place in the weekend, so it wasn't interfering with their classes of the school year. And the language labs were all the other things that in the second half of the intervention were pretty flexible on scheduling. So it was easier for them to get engaged with this as well. So that's another thing of another way to anticipate barriers to your implementation and your program design. If you can't get people to do what you want them to do, you have to really think about how you can make it easier for them to do it. And then the next part would be ensuring sustainability with partners. So I kind of identified a need for funding and administration moving forward, and also given that the course started out with just 8 people, that was fine for CHAMP, just a small clinic, and they could accommodate 8 people very well. But if this program was to go on more for future years, there was going to be kind of a backup of people that are training that they just can't all work at this one little clinic, CHAMP. So it was kind of, I realized one of my sustainability problems might be practicum placements, given the limitations of the clinic I was already partnered with. So that was obviously an issue that needed to be addressed. And in seeking partners, I thought about shared interests. So going back to the fundamental mission, I wanted to maintain the integrity of the program. I wanted to establish a mutually beneficial relationship, and I wanted to achieve my desired goal. So I made sure I really specified in approaching them why it was important for them to have interpreters, trained interpreters, as opposed to just anyone. So I had to really clarify why interpreting training is needed, as opposed to just taking anyone who has bilingual proficiency. And then establishing a mutually beneficial relationship, now that they know that they need trained interpreters and not just anyone who speaks 2 languages, I'm here to offer you trained interpreters. So that's kind of mutually beneficial because it gives me a practicum site for where my interpreters can go after they're trained and they want to volunteer, and then it gives you a trained interpreter. So that was kind of how you can establish a mutually beneficial relationship with a community partner while maintaining the integrity of the program, which is I'm only giving you anyone who I'm giving you is someone who's trained to interpret. So my goal of improving the care for immigrant populations is still being accomplished because now at your clinic you're offering better care to these patients. So sustainability partner number 1 that I identified was IFAP. It's a global health program, Colombia, and it supports summer internships, scholarly projects, clinical elective rotations, and research opportunities. So I kind of sought them out because a big thing of what they do is they sponsor Spanish language and Latino cultural immersion programs with the goal of teaching skills that will improve the provision of healthcare for Spanish-speaking immigrants. That's like perfectly aligned with my mission of my program and my intervention. So I talked to them about what I was doing. They're very invested in student education, so I used that angle also to make it a more mutually beneficial relationship as well. And they became my partner moving forward for ensuring sustainability, like funding and administration when I'm no longer able to do that. So, because obviously if this is like a full-time job after a while, training all these interpreters and recruiting them and making sure everything runs smoothly, it's beyond what I can do as a medical student who's now I'm 3 and 4, et cetera, and then graduating. So I really needed them to kind of take over the course once I was done with the implementation of it, and they became a great partner in that way. The other partner I established was the New York State Psychiatric Institute. So that addressing the issue of not having enough practicum placements, I kind of wanted to seek out someone who was bigger, who could take more than just 8 to 10 people like CHAMP could, the smaller clinic. So one of the people I identified was the New York State Psychiatric Institute. This is a big hospital, and it has a lot of inpatient units that actually have specifically for the Washington Heights community. They have one that's 22-bed inpatient unit, and that obviously in Washington Heights it's a lot of patients who speak Spanish. So a lot of the patients in this unit actually are Spanish speaking. I think maybe I would say 80%. So, and a lot of them do need interpretation. And currently, or back when I started working with them, they didn't have anyone who was trained. They just had untrained interpreters that are volunteers, just like CHAMP. And they always have a constant need for trained interpreters. It's a 24/7 type thing as opposed to CHAMP, was once a week. So they were obviously in great need for trained interpreters, and I had a need for practicum sites for trained interpreters. So I approached them in the same way I approached IFAP, kind of talking about our shared interests and my mission, what I was doing, what I could offer them, what they could offer me. And they wanted to jump on and get trained interpreters. So it was not really costing them anything. It helped them do better, so they had no problem with it, and we established a partnership that way. So basically, with those two things, we can see like I guess the theme is like, if you have an issue, you gotta really find ways to like address it with partners. Partners are great because they offer you a solution without you having to do much more than what you're already doing. For me, with administration and funding was needed, and increased practicum spaces was needed, and I found those through IFAP and the New York State Psychiatric Institute, and they provided renewals of interpreters for CHAMP and for in general, the medical profession through New York State Psychiatric Institute. So that was kind of all about program design. I know I was kind of quick, and I know it's kind of hard to picture without you knowing my program as well as I know it. So if you have any questions, feel free to just ask it in the chat or in the Q&A, and I'll answer them. If not, I'll move on.
All right. So I want to thank you for presenting.
Wait, hold on. I still have one last thing. Sorry, the lessons in volunteer recruitment is that, sorry, yeah. The lessons in volunteer recruitment, I guess, this is a much quicker thing.
Take your time.
Volunteer recruitment, yeah, no, I'm just saying, it's actually a really easy part of program design. I think setting up a program that works is the hardest thing, and you have to really conceptualize every step. Volunteer recruitment is just about finding people that are willing to do what you want them to do. And that's not as hard as you expect. It's just finding someone who actually wants to benefit from what you're doing. So volunteers for me, I wanted someone who believed in my mission. So I was obviously going to be someone who wants to help patients in general. They could receive a non-monetary compensation or benefit. For me, was someone who was bilingual and wanted to actually be trained. They could come out with a training for free, because I wasn't gonna charge them to train them, so they could get like skill sets for free. And third, and the last one is, you could also find people who have to volunteer for some reason. So there's a lot of people, a lot of like high schoolers and even college students who they feel like they have to volunteer because of X, Y, and Z, either getting into college, getting into medical school, etc. If they already feel like they have to, go ahead and use that. If you have a lot of undergraduates who are pre-med and feel like they have to volunteer at free clinics to get into medical school, that's fine. If they're doing good work, that's good for the community. Go ahead and capitalize on that. So I clarify my mission for everyone who wants to. In volunteer recruitment, you got to clarify your mission, like what you are trying to do and what you want them to be a part of. You have to identify possible non-monetary benefits for them. So I advertised the fact that they were getting a free training that they could use moving forward in their life. And all that comes with it. And I identified then groups that could be source of volunteers for any of the above reasons, which for me were pre-med undergrads, basically, trying to get into medical school, who are just intrinsically motivated to help underserved communities and patients in need, et cetera. So that was kind of how I found my volunteer pool. And I think these principles could be applied to anything you do. If you're trying to recruit people for other type of community service, I think it's also going back to like, what kind of community service is it? Is there any group that aligns with my community service mission? What can they get from it? And what can I offer them that they might just need to be filling regardless of this program or not? So yeah, that was basically it. So there were two parts to that. The design part was kind of, it's kind of just really ensuring that you have a good set goal in mind. And there are specific steps you need to outline. And you have to identify community partners that will help you achieve that, and identify barriers and solutions for them. And the last part is just finding people who align with your mission to help you achieve that, the volunteers. So yeah, that was basically it. If you have any questions about anything, go ahead and ask through the QA or the chat room.
Okay, guys, so if you can, thank you, Oz. Thank you so much for that presentation. What I'm going to do is I'm going to try to coordinate this through this feature, and if you can just put on the chat if you have a question, and then we'll announce you to be the person to unmute. We can do that now if you like. If there's anybody that has any questions, post your name, your name on the chat, and you can unmute. I'll announce you, and you can unmute. So Jacqueline has no questions. Thank you, Jacqueline. Anybody else have any questions for us? Okay, so I think I see Kwame. So if you can, Kwame, if you can unmute your mic and ask the question, everybody else remain on mute. Go right ahead. So Kwame, if you can unmute your mic and go right ahead and ask the question. Okay, I'm not sure if he's having problems on his side. So his question, as you can see, says, how did you have time to establish these relationships and do all this planning while keeping on rotation?
You mean like the medical rotations?
Yes.
So I actually started this my first year of medical school. My first year with Diverse Medical Scholars was first year of medical school. So I actually had a lot more free time than I do now or in third year. But basically, it did take a long time. I had just made time for it. It was one of the things that I was passionate about. I think if you're not passionate about something, it'll be hard for you to make time to do it. But I wanted to do this work to start with. So I think that really motivated me to move forward and push on. But as for the partnerships and establishing relationships, it takes less time than you think. I think what the point of the partners are is that it's mutually beneficial. So it's not that you're really convincing them every day of like that they should be your partner. It's more about you find someone who you think is gonna latch on to what you're doing and then just work with them to make it happen together. So I found people that I knew were gonna say yes, basically, because I was pretty sure my mission aligned with theirs, and I explained why it was important. I explained why it would be good for them to join me in doing this. And the actual implementation is what took a little bit more time. It was actually sitting down, a few meetings with them, kind of mapping out how it's actually going to play out. But it doesn't take as long as you expect. It's just a matter of finding someone who actually match that mission. And I think in your communities, you'll find people, if you talk to people about what you want to do, you'll get kind of routed to people more and more as you go.
Okay. Thank you, Oz. Is there anyone else that has a question for Oz? You could either post your name or go right ahead. Any other questions? Okay. All right.
Yeah.
So
I saw Tatiana. So so the question was, do you feel the program is ready to be implemented at other schools or hospitals? And I see Kai's hand, so you can go after. So yeah, I think the program is ready to be implemented at other schools and hospitals. What I'm hoping to do this year through the third year in the fellowship is actually kind of make it so all this work that goes on in the student-run clinics here at Columbia is able to be like shared with other schools, because I think that we're doing a lot of different things for the clinics here. We have 5 different clinics. And it's kind of a loss if we don't share what we're doing to help other clinics have the same impact and also learn from other clinics about what they're doing that we could be doing. So my third year is actually going to focus on kind of divulging the information and helping other schools develop programs that are working. So yeah, I can definitely share more about this program with you directly if you want to implement it at your school. You can just email me, and I'll put my email here at the end. Yeah, I agree. It's very needed at other institutions. I think Kai had a question.
Any other questions? Okay. You believe that's it, Oz?
I don't know. I saw a little hand sign, but I don't know what to do with that. But yeah.
Guys, scholars, if you have any questions, either post it on the chat or unmute your mic and ask the question. Go through the chat feature and post the question or ask the question by unmuting your mic. Okay.
Okay. So
Right,
I'll put my email here on the chat so you guys can reach out if you want to learn more about this program specifically, or you have any questions about program design. Go ahead and email me and I'll get back to you as fast as I can.
And you guys are also, just for you to be aware, through Canvas, you guys are able to communicate to each other through the Canvas system. So you guys can look at that, and I'm not sure if you're aware, but this is an easy way for you to access each other. Okay, Oz, well, thank you so much. We appreciate your presentation. Absolutely. We appreciate United Health Foundation, its Diverse Medical Scholars Program, for the great work that you guys are out there doing. So from NMF, we definitely appreciate you and look forward to your achievements. Okay, so thanks again for attending, and we'll speak to you guys soon. Let me just